right, good evening, everybody. My name's Jamie Miller. I'm a product specialist here for VitalFit. Myself and our team would love to thank you for joining us tonight. Special thanks also to all the group leaders. Thank you for making this happen and working with us on this webinar to make it all possible. Our topic for today is you and your prostheses. Feel free to ask questions. If you can go to the Q&A box down at the very bottom of your screen. You can also go over in the chat box and put in comments and whatnot. And please, participate, ask your questions. We'll be happy to stop and answer questions as we go along. If we see them building up, we'll stop and answer more. Let's see. We do have, question and answer time with Cosi and Greg afterwards. So be sure to hang out after the seminar so you can communicate with us and ask, very specific questions pertaining to your particular needs. We also have a lot of great giveaways. We have 2 different giveaways going on today. For those who don't win, we will be sharing a 20% off discount code at the end of the webinar. So we hope you'll enjoy that also. Before I introduce our 2 fabulous facilitators, thank you both, I want to go over a few slides for you folks not familiar with the chat and the Q&A features of Zoom. So some of you guys may have seen this before, but Paul, if you will put up the slides for us. Navigating the webinar chat features. If you look at the desktop, you'll see the chat in the meeting controls at the bottom of your screen. So depending on what screen you're looking at, down at the bottom, you'll see chat. And if you click on that, it should open up on the right-hand side. You can type any type of message in that to everybody in general. You can also choose certain people with the drop-down menu. The mobile phone, if you're in a meeting, tap the screen to make sure the controls appear. Click on participants. At the bottom of the participant list, click on chat. You can type your chat message and click send. If you want to change who it is to be sent to, click the arrow next to send to and choose a different person or group. So you want to make sure that you're either sending to the whole group or individual participants. Incoming chat notifications will be displayed as you click on the number at the bottom of your screen, and you can click on participants and then chat to view them. So you may want to take a minute just to go ahead and click on the chat to make sure you know where it is. You can look at the participants and Q&A, and they're all on the bottom of your screen. A few things about how to raise your hand. If you have a question or if you've been asked to raise your hand for an activity, click raise your hand in the webinar controls. The host will be notified that your hand is raised, and when finished, click again to lower your hand. So look for that little hand signal, click it on and click it off just to get used to it. Share a reaction. In your meeting controls on the bottom taskbar, click reactions. Click the type of reaction you would like to send. We love clapping hands, thumbs up. The reaction will be displayed for 5 seconds. So it's just another way to interact with us. And again, if you're on a mobile phone, it's a little different. So to raise your hand, tap the raise hand at the bottom of your screen, and the host will be notified that your hand is raised. Tap lower hand when you are finished. And you can also share your reaction the same way. In your meeting controls, tap more, and this is on your phone. The tap, oh, go ahead, you got that, never mind, it just went away. So, the tap and type of reaction you would like to send, clapping hands or thumb up. So again, you tap more if you're using on the phone. It's gonna look a little different. Okay, Paul, the next one. Asking a question. If you have a question, click on the Q&A button, ask your question, and we will either respond in the Q&A window or we'll actually answer it on air. You can also send a question anonymously. And it actually lets you choose a little check mark where it says send anonymously. Skin, it's what we do. And also these are being taped, so you will be able to go back and review any of our seminars. Maybe you love this one, you can always go back. We have them up on YouTube, and we'll have links for that at the end too. Now, let me introduce our keynote speakers. I think most people know them, but just in case you don't, we have Cosi. She has a master's degree in physical therapy. She has been in clinical practice for 17 years. and she has her own practice in Florida specializing in individuals with limb loss. She also has a live show on every Wednesday night called Cosi Talks Live on her Facebook for individuals with limb loss. Check it out. So go to Cosi's. You should like Cosi and her Facebook profile, and then you can actually get notifications. I love it. It pops up on my phone on Wednesday night. So even if I'm in the middle of doing something, it pops up and I know to join in. Greg Mannino has been in the prosthetic industry for 20 years, working for manufacturers and consulting on new technology. He has been a certified prosthetist for 10 years. He is also a 22-time medalist, world champion in the Olympics and Paralympics and alpine skiing. Greg, you are my hero, and we love you.
Jamie, thanks.
Anyway, Cosi, do you want to start with the beginning of the topics? Or
Sure. Yeah, I'm ready. You ready? We're good. All right, we got some few people that jumped in at the last minute. We got Molly in, so thank you for joining us, Molly. Jackson, D. Jackson says you don't see the participants. Maybe you might not see them, I'm not sure, but in the chat window, we'll be able to see whatever questions you might have. Hey, Johnny D, thanks a lot. All right, guys. Welcome tonight. Thank you so much for being here. I do want to say a special thank you to VitalFit. Those of you who know me from the Cosi Talk show, you know how important I think education is for the amputee and the limb loss community. And anything that we can do to just put out new education out there in different avenues and in different platforms, I just think it helps the community as a whole. So thank you to VitalFit for this opportunity. And not to mention, I love working with Greg, so it's always a pleasure working with him. So guys, tonight's top, we're gonna talk a little bit about the things that VitalFit has to offer, and then we're gonna go ahead and talk about the changes in a residual limb and how that affects you as an amputee and as you use your prosthesis. So those of you who are not familiar with the VitalFit product line, it's basically, it was designed by a dermatologist who's been a dermatologist since the 70s, and this guy has been around for a long time treating skin. This is all he does, and he created a line specifically for diabetics and prosthetic users. And it's a 4-part line. It's got the cleanser, daily moisturizer, liquid to powder, and nighttime moisturizer. Fantastic product line. And probably one of the reasons why I've been so gung-ho about getting this out there is because the 17 plus years that I've been practicing, I didn't have anything like this to offer my patients. It was always drugstore remedies, and every once in a while it would work for somebody and somebody would say it would work, but for the most part, there was nothing I could offer to all of my patients. So that's kind of one of the big things I love about this line and keeping the skin healthy. And I know Greg is really great about talking about skin health, so I'm gonna let him continue with this.
Thanks, Cosi, and welcome everybody. Thanks for having us on and tuning in tonight. Again, like Cosi mentioned, is the main reason we love and we're so behind VitalFit is it's a product that was designed for the limb loss community. And there, like Cosi said, there's nothing that ever existed out there. We were using whatever you could find over the counter to try to remedy the situation, if that was a fungal infection or chafing or sweating. But the VitalFit system has addressed all these, and it's so unique. As when I discovered it, I was just completely over the moon that I could actually try to spread the love and talk to people about the success I've had it, because I'm a above knee amputee. Everybody knows as well. But what it's done for me, and we want to get out and spread the word. And so thanks for tuning in and listening to some of our comments, and some of the Cosi Talks has a lot of different hacks to address the issues in volume change and, perspiration and what we can do about that. And so, yeah, I think it's great. Thanks for tuning in tonight, everyone.
Should I go ahead and do a first giveaway before you guys start on the actual webinar? Get things started? Does that sound good?
Get people moving.
Yeah. Okay, everybody, I'm getting ready to put a link up in the chat, and I'm going to send it right now. And we want you to go to our website by following this link, and we do incredible articles. We have wonderful blog posts all the time. So this is the first blog post that you'll see when you open up this link. You need to type in the chat box how many tips for summertime skin are in the first blog. So it's a number I'm looking for, and it's in the title of the article. So go to the blog I just put up And whoever's the first one in here will win a travel size kit, 4-piece travel size kit.
We need the
Oh, we got a winner.
Wow, look at that. Quick.
Oh, quick draw McGraw.
Yeah, there you go.
D. Jackson.
D. Jackson, nice.
Okay, and while you're at that page, before you come back, just to let you know, take a look when you in your free time and look at all the articles. We're going to be posting new articles every week. If you have any topics that you would love for us to write about, please just send us a little text, email, and we'll take care of that too. Okay, you guys are on now, Greg and Cosi.
Awesome. Okay.
All right, guys. So to kind of kick this off, and I love it when an audience is really interactive. I love hearing from you all. So right now, I want to hear from you all. How many experience changes in the volume of their residual limb? And if you don't mind also, if you want to put in yes or me or 2 thumbs up, if you don't mind putting how many years you've been an amputee.
Okay.
There's a reason behind that.
It's a big deal.
So if you can just type in there, if you still experience volume changes in your limb and how long you've been, okay, so we're already getting the answers. Tom says throughout the day, he's been an amputee for 59 years. Michelle says yes, she's been an amputee for 3 years. Scott says me, 9 years. D. Jackson, 2 years. Okay, Mark, 16 months. I am, daily. Mitch says daily for 1.5 years. Michelle for 2 years. Ashley says coming up on 3 years and has had 5 sockets. Yep. So guys, one thing that I see that is so frustrating for my patients when they come into my clinic is the way their limb changes. And it's directly tied into having to learn to manage their socks and their sockets and socket changes. And this is something for them that is very frustrating because they don't understand what's going on and the whys behind it. So, and the general textbook will tell you that for the first year to 1.5 years after amputation, you're going to have majorly drastic changes in your residual limb. And a large part of that is due to the inflammation moving out of the limb from the actual surgery or trauma itself. And also added into this is the muscles. The muscles are starting to atrophy. They're starting to remodel, to change their shape and accommodate to a new shape. Now, in some amputees at about the 1.5 year mark, they will kind of plateau. And if any of you have hit that plateau, write that in there, type that in there, plateau, where the limb isn't changing quite as much. And it might have some changes throughout the day, or it may just stay completely stable. But the more I'm practicing, the more I'm seeing that amputees who are years out of their amputation are still experiencing some pretty drastic changes in their limb volume. So Greg, what do you see in your clinic with this?
No, I agree 100%. And I'm reading all the comments. So we look like we've got quite a bit of seasoned users here, 8 years up to 59 years to 3 years. And I think really Cosi has it right on. You will change volume, and especially in the first 1.5 to 2 years. And the more active you become, you encounter changes there. You start building muscle and you start getting hypertrophy. So I've seen patients where they've reduced their volume from their first couple of years, and then they start getting comfortable and being very active, and then they start increasing their volume. So from regrowing muscles, hypertrophy of the muscle. So we do see it quite often. I see it a lot from dehydration too, in a change of volume. And I think that's the biggest thing. I've been amputee 41 years. So what I experience is when I'm dehydrated is when I start having problems. I'm pretty stabilized. And I think when I look at Tom, I've asked Tom to throw out another comment. After 59 years, he's still experiencing volume change. So remember, this is something we're going to have to deal with quite a lot. So Tom, yep, going golfing and 15 clients a day, you'll shrink that equivalent. Well, you do live in South Texas too, right?
Yeah.
So, but that's a big thing. So, the sweating is what's doing that. You're really losing a lot of volume of water because of the outdoor ambient temperature. So we've got a solution to that with the VitalFit system. But I think a lot of people that I speak with and encounter currently is a lot about the climate is what changes the volume. So.
And that's a lot of also what I see with my patients. And usually what I try to do when someone comes in and they're very frustrated with the way their limb is changing, there are ways that we can try to kind of pinpoint to see the reason behind it. The first thing I normally do is if it's the first 1.5 years, then that to me is like the biggest culprit. It's the first year and a half. And it's kind of the, okay, we got to kind of suck it up, buttercup, until that first year and a half is over and we see what that limb is going to do after that point, if it's going to stabilize or not. If it's somebody who has a known comorbidity, meaning they have high blood pressure, they have diabetes, they have an autoimmune disease, kidney disease, heart disease. There's a lot of diseases and pathologies out there, medications that people are taking. I always look at my patient's medication list that can really dramatically affect water weight gain and loss. And if it's something with regards to medication, and I did a big show on this not too long ago on the Cosi Talk show, checking to see if all of the medications are working together the way they're supposed to, or if there's something that's counteracting something else and a call to the doctor is in order. Also, is the disease being managed properly? Is your diabetes under control? Do you have that glucose under tight control? Your blood pressure? Are you hitting the potato chips at night, which I know is my weakness, okay? Causing that blood pressure to go up, causing that water to be retained. So the medical history can play a huge role in this.
Oh, there we go.
Chris is trying to pop back on here.
Oh, Chris, hello, she's back. You lost Cosi there on it. There you are. Good points, Cosi, because the underlying medical issues can change your volume tremendously. So huge points. Make sure your medication is being taken as prescribed. Stay hydrated. Manage your stocks. In the first couple of years, like Cosi said, you really, it's a fluctuation that you're pushing out the edema, your hypertrophy. There's so many different things going on. And if there was underlying medical issue, you're still trying to manage that as well. So that being said, if you're experiencing extreme fluctuations in your 3, 5, 8, 10 years out of amputation, then maybe we need to call a physician and look at this a little closer. It could be something that's under. So, but if it's as simply as you're going through, 3 to 5 to 8 ply or something like a day, we can manage that by hydration. VitalFit products, I think we can manage the sweat, which will help and reduce this. But again, I think Cosi has a huge point. Diet and exercise is one, but diet's a huge thing. If the potato chips at night, it's one of my weaknesses too. It's just what I like. So that's it's a big deal. So you got to be really aware of what your intake is. I think when you become an amputee now, you're aware that you've got to be more active. It's all the patients I work with. You've got to continue on and manage your residual limb, manage your socket ply, manage that your process is doing a good job and keeping you active. And all this translates into volume and getting your volume stable. So.
One thing I do want to add is regards to hydration. A lot of times when folks are gaining water weight, whether it's due to medication or something, another underlying issue, they think that if they stop drinking water, that will help with the water weight. And this is a huge urban myth and legend that I always like to address with my patients. The water that you have when you have edema, when you have that extra water weight that you're carrying, it's not in your circulatory system. It's in the soft tissues. That's where that water is. It's called extracellular, okay, versus intracellular, meaning inside the cells. So the irony is the better way to manage your water weight gain is to actually stay hydrated and keep flushing your system with a lot of water. And I say this because it can be very dangerous, especially here in Florida, states like Florida, Texas, for example, where people will stop drinking water in an effort to get their limbs to shrink back to a more manageable size. So I do want to kind of point that out. There was another question here. Mitch says, I'm a newbie, 1.5 years. Is it going to just keep getting smaller? And what can I do to stop it? Exercise. So Mitch, yes, it probably will continue to get smaller. And if you kind of just step back and think about things, our bodies are constantly changing, whether or not you have 1 or 2 legs. Your body is going to keep changing as it gets older. And that's how you kind of have to think of your residual limb, is it's going to keep changing as you age. And yes, those muscles are going to atrophy, and to a certain extent, there's not a whole lot you can do to stop it. You definitely should keep exercising, absolutely, because the muscles that are still intact need to be even stronger to compensate for the ones that are no longer there. and the ones that are just kind of transected, the ones that are halfway still there, they are getting a little bit of that contraction. Okay, they'll never be as strong as they used to be, but it certainly warrants continuing exercise.
Yeah,
All right.
huge point. I think that's a huge point, that keeping your activity levels up. And if you're exercising and have the ability to go to a gym, not everybody's open right now with the current situation, but I think walking is one of the best things you can do. Just go out and walk your dog. Just go out and walk with your spouse, and put in a little extra every day. That these things will reduce volume. And Cosi has it right on. I've had so many patients that they refuse to drink water because they think they're retaining water, and it's just it's absolutely the opposite. So I'm a big proponent of staying hydrated. Hydration will affect your socket fit, affect your athletic performance. So we've got to really focus on hydration. I think that's one thing we discussed a few times in the show, and haven't really got in depth about how important it is for cellular health. So that being said, when you start going out and exercising more or sweating more, that creates issues in the sockets. And again, we need to talk a little bit about that and how to prevent it. Maybe that's another question we could put up. How many people, because it is still summer here, in most of the country, are experiencing sweat issues? Because if you're sweating a lot, though, that's not a bad thing, because then you're expelling some water, and as long as you're replacing it. So,
yep. So guys, how many of you out there are still experiencing in September? I know here in Florida, it still feels like it's July.
Yeah.
Problems with sweat and losing fluid there. Yeah. Mark's another Floridian, so he knows all about sweat. Yeah.
So it's a big thing for me in the performance and the outcome of every day if you can reduce your sweat problems. So if that, as we all know, if we sweat and we've got to take time out of our day to read on the prosthesis or stop, it's just the overall inconvenience, or add a sock. We can try to control that sweat is the first thing that we want to think about. In the past, I know Cosi was big with this too. We'd go over-the-counter products to address sweat. Now we have the liquid to powder from VitalFit. And it's probably one of the best products I've ever seen produced for the limb loss community. And not only limb loss, now we're talking about everybody, even athletes. And I want to get your feel on that, Cosi, if you've been testing it with the running you're doing and stuff too. But but everybody here, I'm reading as the chats come up.
Yeah,
kind of something that everybody's suffering for. Sweaty daily in Seattle. Yeah. Mm-hmm.
Yeah. A lot of Floridians here, so y'all know all about sweat. Tom in Texas, that's another hot as Hades over there. We've got D Jackson and still sweating in North Carolina. So guys, this is, again, it kind of, looping back to these products, I really do like what this has to offer, because it does help protect the skin and prevent the shearing and friction that sweating can cause in the socket. It can't prevent, obviously, from complete all of the sweat, but it helps manage it quite a bit.
That's good.
And again, yeah.
I'm sorry about talking.
Sorry, no. I'm reading through the comments here, making sure we don't miss anything. There was, and actually we'll get to that. Remind me at the end, we'll mention something about the adjustable sockets, because that's something that,
okay, yeah.
To address that as well. So how many of you guys, okay, so here's another quick poll. How many socks, how many ply, not how many socks, how many ply do you all use throughout the day?
Yeah, good one. Yeah.
I want to know.
Are you stable enough? Is people who are not adding ply? I'm curious to hear that. 3 to
Mitch
5.
Says 5.
Yeah, I see some. I got a couple barking dogs on there. Thank you.
Yeah.
That's
John,
my dogs.
3 to 5. Michelle's 3 to 5. Carissa's 1 to 5. 3 ply all day with Steven. Yep. Glenda is up to 13 to 14 ply.
Oh,
Barbara says none. Bob is 7. If anything, a single ply. So this is something that the minute my patients walk in the clinic, this is something we are addressing. I'm addressing skin health. I'm addressing how to don a prosthesis correctly, and then also how to manage socks. And so far, every clinician I've talked to, they have their own little technique of how they teach patients how to use socks. So you guys are going to be lucky to hear from 2 different people today. When patients come in, I'll usually talk to the prosthetist first if it's a brand new patient, and just say, okay, what did you see with them in the clinic? And if the prosthetist tells me, yep, they were wearing about 3-ply and that was a couple of days ago, then I know 3-ply is my starting point.
That's right.
But it may not necessarily be where they are a couple of days later for all the reasons that we just talked about, that things change, even from just the morning until the afternoon. So what I'll do is I will look at the patient and put on the amount of socks that I feel like they need, have them stand in the socket, and then I'm looking at certain landmarks. As a clinician, I'm looking to see, are they too far up out of the socket where I've put too many socks in them? Do they have that bottoming out feeling where they feel like the bottom of their limb is just pounding the bottom of the socket? Do they feel like they're kind of caught where they're not bottoming out, but they feel like they're still kind of swimming in the bottom there? And that starts to kind of give the impression. Once I have my patients in the correct amount of socks and ply, I have them stand and do a ton of weight shifting.
Right.
So that they can start to understand what it feels like when the socket is fitting properly. Because I think that's one of the hardest things for folks when they're first learning to use that prosthesis is, well, how is it supposed to feel? I don't know what the correct way feels like. So it's a little bit, 60% science, 40% guess and check there in that regard. How about you, Greg?
No, it's exactly right. I think we came from the same school of learning, because I follow the same protocol of initially setting people up, because in the beginning, we're not sure how it's supposed to feel. We're not sure. And I've seen a lot of patients and prosthetists out there, they don't really have this step of the equation showing how to don the prosthesis right to really be in tune with it. So you're spot on, Cosi. I follow the same protocol, a lot of weight shifting, a lot of movement. And once I get the patients up and moving, then we start talking about what we do when we dehydrate or we start feeling loose or tight. I'm reading some of, Ashley said she doesn't wear socks. Very active. She adjusts her prosthesis 2 to 3 times. So let me ask that, Ashley, I got a question for that comment there. Are you adjusting that because you're sweating out of the prosthesis? And is that why? Because of the activity? Or, because I do know some patients that don't wear any socks and they've stabilized and they just continue on without having to address that. So that's a good thing. So,
and then, usually what I do after we've kind of hit that sweet spot where we finally got the patient where we want them, anything after that, I always have the person refer back to what that felt like. Because as many of you probably know, and go ahead and raise your hand or throw something in the comment section, how many of you, when you put your prosthesis on first thing in the morning, you have some sort of routine where you either hop into it or you walk around your bed 3 times, or you do some particular walk and then you have to take it off and put it back on, put another ply on. I see a lot of my patients that have to do that because just even those first few steps in the morning will start to adjust and make changes in the limb.
Right.
So I'm a big stickler with my patients with this. Don't settle for not being comfortable. As much of a pain in the neck as it is to have to take it off and either take off a sock, add on a sock, redon everything again, it's worth it if it means you're going to be comfortable in that socket. And even times in my own treatments, I usually have 1 hour one-on-one treatments with my patients, and they are going the entire hour. And there's many times where we have to stop 2 to 3 times in the same session to add a sock because just the amount of activity we're doing is causing that limb to shrink down.
Right.
So Mitch says he hobbles to the living room. Bob from Florida says, yes, I have to move around. Tom says when he was total contact skin fit, he had to get up early and put the legs on immediately or might not get in properly. And that's just not an issue now it's not an issue thanks to the adjustability of the sockets.
Yeah. That's a great thing to have these adjustable sockets. Just on that note with Tom alone, with the Click Medical, they're neat. I mean, the adjustability to be able to open up those, bolas to get in and then tighten them down. They're pretty neat. I've got a lot of guys using them. I haven't tested one personally, but luckily, I don't change volume too much. So I haven't seen a need yet to try it, but I think it makes it a lot easier, especially in bilateral cases, and depending on your residual limb as well. I just thought I saw a comment in here. I'm trying to find it. that it almost feels like a teacup trying to don the prosthesis. Here it is. I feel like it's more and more, I'm on it, the more cramp I get, and I'm forcing it into a teacup. So that may right there be Mitch. I'm reading Mitch, maybe too many socks, too tight of a socket there. So if you're experiencing that.
Yep. And one thing I do want to add, and I was having this conversation with my patient today. You remember the half-ply sheath? Do you remember those, Greg?
Yeah, sure.
The half-ply. For whatever reason, I just don't see as many patients using them nowadays. And I think it's something that's kind of a great tool. I don't know how many is there anybody out there who uses the half-ply sheath? So as you guys know, those of you who use socks, you have the 1-ply, 3-ply, 5-ply. I think is there a 7-ply, I think. So Mark says he uses the half-ply. So way back when in dinosaurs walked the earth and I was practicing for PT, we had the half sheath, and that's exactly that. It looks like a nylon, almost like a nylon stocking, and it's a half-ply, which I find with a lot of my patients, it's the Goldilocks scenario. Well, they'll put on 2-ply and it's too loose, but if they put on 3-ply, then it's just too tight.
Yeah.
And you just need that half-ply. And usually I tell my patients, ask your prosthetist for the half-ply.
Right, and they're available, so that's a good point.
They're still out there.
Yeah, they're still out there. It's a great point, Cosi. And remember, everybody who's listening in on this, you got to ask your prosthetists for these. If they just have initially said there's a 1, 3, and 5, and here you go. If you're experiencing this, because half-ply can make all the difference in the world in your outcome, your daily comfort, and so yeah, ask your prosthetist. I agree with Cosi 100% on that.
And then guys, keep checking and testing. I know we have a lot of, like I said, seasoned amputees here today, but for those of you who are, perhaps less than 5 years out and you feel like you're still struggling, this is something that you really have to get in there and test it out. And sometimes in those beginning days, especially if you have a new socket, it might mean having to remove your socket several times a day to troubleshoot how many socks you need. And this is where having a good supply of socks with all different thicknesses, and then making the effort just to see throughout the day how your limb will change, and you will eventually find a pattern there.
Right, and you'll find the optimum spot. So again, we've got to keep on this. Remember, I think we've talked about this in the beginning, is you're driving this patient. You're the patient, you're wearing the prosthesis, you're driving the bus. So take the time. Make sure if you've got to take the prosthesis off a couple of times a day to adjust this, it may be an inconvenience to do at that moment, but it's better than bottoming out and creating other issues. So be cognizant, stay hydrated, try to manage your sweat. I think that's a huge thing. I see a bunch of pop-ups. Everybody, looks like three different people are getting half-ply socks. So that's great. Yeah, that's fantastic.
There is a Q&A question too from Teresa if you click on the Q&A.
Oh, okay.
Right.
So Teresa asks, how do I wear the sock? Do you pull the lip of the suction rim over the bottom or not? I just learned that once I wear the sock, I don't need to wear it every day or all day. Also, is the sock wearing even the thinnest sock an indication that soon I will need a socket change? And do I need to wash the sock daily? Sorry, too many questions. Not at all, Teresa.
No.
Okay, I'm gonna tackle a couple of these and then. Okay, so as far as how you wear the sock, like I said, I'm a stickler for when you're donning the prosthesis, especially for my new users. It all starts with having everything on your skin prepped, everything good to go, and then the liner. The liner, making sure that you roll it completely inside out, and that bottom is in complete total contact with the skin. If there's any kind of air bubble getting in there, you're not going to get a good fit, and it's going to mess up the whole gait and the whole feel. And this also includes how the liner is rotated. And again, this is a point of frustration for many of my newer patients, because if they rotate the liner just a little bit too much, it affects how it feels. When it comes to putting the socks on, one sock at a time. And I know that can be a little tedious, but that's the way you're gonna make sure you get absolutely no wrinkles in the sock, making sure you're looking at the bottom of the residual limb, there's no puckering or anything like that, and putting on one sock at a time.
That's right. Good point. And make sure the socks, and here's a huge point that Cosi just hit. If you have a pin system and you are adding socks there, make sure your socks are on straight, because just this week I was reading about someone who had a prosthesis stuck, and they did everything under the moon, sun to try to get it off, but it was their sock stuck in their pin. And she literally had to like use hot water inside the liner and her spouse to get this off. So be aware of when you're donning those socks that they're on straight. We like to put a reference point on the liner so you know it's on straight all the time, or make sure your prosthetist explain that to you, that you understand where the logo is on there, where it's supposed to be. But be really focused when you're adding the socks, with Cosi saying, because it's huge, because you can end up with, if you're a pin user, and that's a bad deal trying to get them unlocked. So
yeah. Oh my gosh, I've had some serious situations with the pin lock, and even guys to the point where I don't know what the name of this thing is. It's like the little rubber seal that goes around the top of the pin.
Right.
If you don't pull the sock up around it, then it's not going to go in, and you spend like an hour trying to get that pin to go.
Right. Yeah. That's right. So.
Okay, and I think there was a couple other parts of this question. Let's see if we make sure we get it. That she says, I just learned that once I wear the sock, I don't need to wear it every day. And Teresa, that just depends on how your limb is changing. It's going to change every day. You might find that some days you're not going to have to wear a sock, and other days all of a sudden you're up to 6 or 7 ply.
Yep. A lot of that could be on your activity days. If you're finding that on your heavy activity days, you're having to add socks, then obviously we're maybe a dehydration issue here that we want to address. But if you're not having to add socks some days, that's great. That's great. Sounds like your prosthesis is fitting right. So that's good. The end of the question, should I wash the socks daily? Absolutely. I know Cosi's big on this too, but that's why we have the VitalFit cleanser. We can, wash your liners, wash your socks with that, wash your sockets out and your residual limb. And it's really imperative to keep it clean, because that, if they're not clean, they can harbor bacteria, and that can translate into all kinds of bad things. So.
And then the other part of that question is wearing even the thinnest sock an indication that soon I will need a socket change? And I can give you, I was gonna say, I can give you the textbook answer, Teresa. Usually when people reach about 15 ply, that's when the clinicians will start saying, "Whoops, sorry, Bob.
Bob fell over.
Bob fell over." They'll start asking, okay, how is this socket fitting? There are some people who are in 15, I even see them to 20 ply, and they're still fine. They're walking fine, they're doing well. And then on the opposite side, I see some people who are at 7 or 8 ply, and they're completely miserable because they've lost the connection to that socket, and they're losing their balance, and they're having problems with falling. So Teresa, that's something that every person is a little different. And even how prosthetists decide they want to manage it. I know that many of the prosthetists I work with, we try to kind of keep that socket as long as we possibly can before we have to change it, especially if the person is rapidly changing their residual limb volume. But obviously once it becomes unsafe, or once they're losing function because the socket is too big, then that's the indication right there that they need a new socket. Yeah,
I concur. I think if you're losing proprioception, it's time to change it. If you're uncomfortable and unstable, and you're feeling your steps are the same, and if that's 8 ply, then I would say let's look at it. That's where I come from. That I'm a user, so I understand that. So if you're losing proprioception, you're losing balance, and that's 15 ply, and again, like Cosi said, I've had patients with 15 ply and they love it because it's comfortable, and there's a lot of padding, and they don't want to give it up, even though that's excessive. So just be aware. Again, you're driving it, you're walking on it every day. So when you feel unbalanced because there's too much, then it's time to talk to your process.
Mm-hmm. And we've got a good point here from Carissa. She says, I found the sock ply depletes with the use, so numbers not as accurate with sock use and washing. And that's interesting, Chris. I've observed the same thing, where the 5 ply sock is not quite as thick as 3 plus 2 ply. It's like the thickness isn't there. And this is the part where, as the amputee wearing that prosthesis, you need to kind of tune your brain into what it feels like when it does fit correctly. And then when it's not fitting correctly, okay, how many 1 or ply or 2 ply, or play around with it to see what you need to add or subtract to get to that feeling again. So yeah, and even my patients, it's funny, some of my patients that they have some of the socks that are kind of worn out just a little bit, so they know that they're not as thick as the brand new ones, so they know which of the old ones to add combined with the.
That's right. Yeah, I've seen that a lot. They don't want to give up the old favorite, so that's okay though. You know, if it's comfortable and working and wicking out a little bit on your, just, tibia flat, wherever that may be, then it could be the go-to. I get that. So we're not going to take it away, but just, realize they do wear out. So I see Mitch put on here, a little bit of vegetable oil between the liner and skin to loosen that cotton. That works, yeah. Makes a mess though, so you're gonna have to get some cleanser after that. So.
Yeah, and then we've got, it says, what about using tech silicone spots? Greg, do you understand what?
Tech silicone spots. So I'm not familiar with tech. I recall in the past we used to have a silicone spots that you could add in specific places in the socket to if you're having distal pressures and stuff. Yeah, if they work, if they don't stay in place too often. That's been my biggest. I think it's a brilliant thing to have, but I think they move more than they're helpful, and that's been most of the outcomes I've seen with it. So Tom puts in there, they can be great, and that's right, as long as they're not moving around. So
okay. Bob says, how about half ply socks? Well, like I said, Bob, I'm a huge fan of them because again, it's that the very small adjustment that oftentimes my patients need during the day to get themselves comfortable.
That's right. So a lot of this discussion, I think, really bases on managing the volume. Okay, and I think we initially talked about hydration manages it, perspiration. If you manage your perspiration, you can manage your socket flight. Probably the biggest thing that I see out there is people sweat their legs off, and they're always removing something or changing socks because they're sweaty and liners. So again, I can't say enough for the liquid to powder at this scenario of the discussion that it helps so much, and it'll help manage your ply basically if you just use this one single product. So I think it's pretty interesting reading. I'm still reading comments popping up. Stepping away for a moment. Oh, okay. Normal start out with 3 ply at the end of day 5. Yeah, Mitch, I think that's good. I think that's not a bad deal. You pretty much sounds like if you're only going 2 ply, you're pretty stable. So
that's actually really good, Mitch.
Yeah,
one of the guys I know, he's been an amputee now for 30 years, and he starts the morning off with 5 ply. He says at lunchtime he's 10, and by the time he goes to bed he's 15, and then he starts the clock again in the morning, and that's just
what works for him. Okay,
that's just how he is.
So yeah, and that's okay. I think that's okay. It's a little excessive, but if that's working and he's going throughout the day comfortable, then that's fine. I'm all about it because he's got it figured out and he's managing it, and life goes on. So that's a good story. I like that. So.
All right, guys, go ahead and keep putting your questions in. I think Jamie is probably going to do the next giveaway.
Yeah, that's what I was going to do. We'll still keep answering questions. Yeah. Paul Sewell is going to put up, I'll put a link in our chat that's going to take you to a survey. We would love feedback. All the information you give us helps us to, cover topics that you would like to hear us talk in the future too. For the giveaway this time, we're giving away the full size set of the products. So you get a full size 4 products. And all you have to do is fill out the survey. Then Paul Sewell, who's on the back side of this, will be choosing a winner by drawing the name of whoever fills out the survey. So we hope that you will fill it out and give us some feedback. Constructive criticism really helps us grow. So we would appreciate, even in this format, you can also always send us a message too in the future. So we can give you what you really want on these webinars. Paul, you put it up? Yep, there it is in the chat. If you click on that, and then Cosi and Greg, you guys can start also reading the questions if you missed any. Yep. I think we're doing pretty good.
I was going to say, guys, I'm not an amputee myself, but I love these products. I actually do a lot of running, and I do a lot of workouts in chlorine and beach water, and these lotions are fantastic. And the reason why I mentioned that is because if you've lost one limb, it's now even that much more important to take care of your other leg, of your other lower extremity, and the skin there. So these products are meant to be used all over. So go ahead and take care of that other side as well.
That's a good point. As we're waiting for questions, I think Cosi said, I'm curious, are you testing it and having good luck with it too?
Oh yeah.
I've had a lot of different people testing it, not only the limb loss community. I've got the fire department right here in my town, guys testing it. We got them some samples just because, again, it's reducing the friction and the perspiration. These guys are working in their full gear and in the heat that it's still devil hot here in Colorado too. But so it's amazing, everybody who's still tuned in here, not only for your use of it with your prostheses, but if you're riding a bike, if you're cycling, this friction that can be created on your sound side from the saddle, you can use the liquid to powder there to reduce friction. So the whole skincare system is really designed to optimize your outcome every day. So if we start with the integrity of the skin, the things that Cosi do, the things that your Prosthesis do for you, it's just going to get better and better and better. So it's preventative care that we got to think about. It's like the same thing you're doing when you're managing your sock ply and your prostheses. You're preventing, potential problems. Let's go even one step deeper. So that's kind of a fun too, right?
Tom's back.
Tom's back. I see that. So I did see one comment here, and I'm trying to roll back here. Somebody was wearing a BOA system too. I saw that. That's great. I'm curious to see how the sock ply management is going with the BOA. If you're adding sock ply or you're using the BOA more. So that's a good question.
Yeah. No, I know that I covered adjustable socket technology about a year ago on the show, and I know there've been some advances since then, and it's something I definitely want to revisit.
Yeah, I think it's a good point. I mean, if we can reduce how many sock ply we have to add by turning a dial, I think that's huge. So I can't seem to find it. But
there's a question and answer too that just came in from Jillian.
Okay. Let's see. Jillian says, I have the pin system and I put my leg on, it goes all the way down. So then I put a 5-ply and it still goes too far down. So then I put on a 3 and I can't always get it lined up. So I sit and stand and sit and stand and then it slides in. I don't know why this is happening. So that's interesting when you.
So you're going with 8-ply. So 5-ply is too much distal pressure. Adding 3. So here's exactly what Cosi's talking about. If you had maybe a 2 or a 1/2-ply, so maybe you go 5.5 and C. It could be look through your stocks too. It's another huge point of if you've got a few that are a little bit more worn, maybe a 3-ply that's been used quite a bit and a little bit thinner, maybe play around in your ply there and find which one is going to allow you to just line up and get in the prosthesis. I think some of the most frustrating things we can have if we're standing up, sitting down, trying to get it on, trying to align it. Be cognizant about that pin alignment too. You've got to really make sure the liner's on straight, the socks are aligned, and where that pin is locating. I've had patients that really struggle with pins, so we've gone away with those patients. They can be the most awesome suspension, but they can be a little tricky to line up. So just practice makes perfect, I think, in that situation. But it's exactly what Cosi says. Maybe a 2-ply or a 1/2-ply, and you find the beautiful medium between them. So.
Mm-hmm.
I do have a winner now, so I'm going to go ahead and announce that. So thank you to everybody who filled out the survey. The winner is Levenit, L-E-V-E.
Oh, Michelle.
Yeah.
Michelle, yes.
Yeah.
I think I saw her name. Yes, Michelle Levenite.
Good.
So congratulations.
Congratulations.
Awesome.
I'm going to just go over a few more things, and if more questions come in, you guys can jump in. I want to remind everybody for future webinars, please visit our website. We also will have them listed on Facebook and Instagram. Also, please sign up for our emails. We won't bombard you, but we will send you reminders when we have a new blog post or we have new webinars. Paul is going to show us the discount code if we don't have any more questions, but I'll wait one more second on that. Oh, there it is. Okay. This is the discount code that everybody can use today. If you go to our website and at checkout, after you go to payment, there'll be a little box and you put in VITAL20 and you will get 20% off your next order. It's one use per customer and the offer ends September 19th. And it's not available on subscriptions, but we do have discounts on our subscriptions also. So that might be of interest to you. I think I have the emails, but I also need, for the 2 winners today, if you guys can just fill out, send us directly on our website for info@VitalFit. If you can send us your shipping address so I can make sure to get your products out to you. Are there any more questions that came in? Cosi or Greg, anything else?
Yeah, I'm looking through here.
Yeah, 2 more just popped up. Okay.
Michelle says, yay, I'm giving one of my samples to my leg dude.
Yeah, good.
Okay, I think, wait, ooh.
So I use liquid to powder. Here's one. I put it on after I bathe and then use a blow dryer to the powder before I put the liner in. You can either use the blow dryer on there or you can just let it dry. It takes a little bit of time. The real key is letting it dry. Mitch, I think if you're in a hurry and you're trying to use that blow dryer to go ahead and dry it down, that's not a problem. But as long as you're not using too much, I think that's one of the things that anybody who's going to purchase this or won this product, a little goes a long way. So start out with a little bit, dime size dab, and go there. I've had some people maybe overdoing it a little bit, and they were waiting for it to dry, and then they don't wait, and they don the liner, and then it almost feels unstable or slippery to them. So I think it's okay to use that blow dryer if you're okay with that. Stephen has another question. I'm getting a new socket and the liner doesn't accept socks. It's the removable Oster seal. So can you use socks with those? You can put it above that seal to take up volume. But I think if your prosthesis is fitting you, Stephen, with this with the movable seal, so that's the X liner, I believe that you can move that seal around depending on your volume change, which I think they're awesome. Then you're probably pretty stable. You're not changing too much. And the positive thing about that movable seal, and I think I sent that to you, Cosi, remember looking at those, you can move it up or move it down depending on where you're feeling any looseness. So that's cool. Yeah, I think that's a good thing. It's a good liner. So.
And then Bonnie says, does the half-ply sock come in any other material? Allergic to the nylon. Bonnie, honestly, I call them nylon sheets because they look like the pantyhose, the nylon sheets of the 80s and 90s. But I would actually look, Greg, do you know off the top of your head?
We can, you know what, off the top of my head, I know they do, but unless okay. We can get some information back to you, Bonnie, on that one, who's making them, where to get them, or what to ask for, okay? Right off the top of my head, I want to say NetRite has it, but let me look a little deeper into it. But
yeah, and that's a good point. Tom brought up a good point. Put the half ply outside the other sock. So if it is a nylon sock, excellent. That's
right. Yeah, it's excellent. Yeah, but good point, Tom. That makes sense. Okay.
And
but
then
if you seriously are, if it touches your skin, you're allergic, then let's find a different material. So
yeah. So Michelle says, Michelle K, it was actually Michelle L who won the prize, just to clarify for you. And then for D Jackson, if you can enter your address on the, I'm sorry, Jamie, it was the VitalFit website?
Yeah, it's the VitalFit. If you just put in contact us, it goes to info@VitalFitSR.com. But it's just contact us and you can send us a personal message.
Okay. And then this might be the last question we take, but it's an excellent question, David. How do we know how often to use shrinkers if we are not using our legs every day? I don't want to lose the fit I have.
Use it every day.
I use it, yeah. And I tell my patients, if they're wearing their leg throughout the day, wear their shrinkers at night. A lot of my patients say they feel more comfortable because it kind of encapsulates all that soft tissue and it just feels more comfortable when they're sleeping at night, and certainly helps with getting into that socket first thing in the morning. And David, for someone like yourself who's not wearing that prosthesis every day, all day, then I would definitely say make sure you're wearing a well-fitting shrinker, making sure it's not too stretched out,
right.
And also not too constricting.
That's right. I've had patients that will actually wear their liners just as a shrinker. They just want to wear the liner when they're not in the prosthesis, just to manage their volume. So whatever works for you, that's great. I think I would go ahead and wear the shrinker if you're not in it every day, and you're experiencing effort trying to get in, like if you were one day off. So yeah, wear the shrinker, and you've just got to do that. I think that's that's pretty important. So.
Okay. I think I'm going to go ahead and wrap up. Is that everything, guys? I have a couple more slides. Paul, can you put the slide up for me? First, I want to thank you, Cosi. Thank you so much. Cosi Talks. We said Wednesday night at 8:30. That's Eastern Standard Time. We advise you to follow Cosi. Go onto her Facebook page, and you can get notifications of her talks also. Greg, thank you so much.
Pleasure.
It's been wonderful. And I have one last slide. Normally, Christine Erbacher will be doing these webinars. I jumped in tonight doing some technical problems. This is Chris Erbacher at VitalFitSR.com. She is a great resource. If you have any questions, any special needs that you need somebody to get back to you, you're always welcome to go to our website and hit info if you can't remember it, but you may want to jot down C. Erbacher at VitalFitSR.com. And Chris can help you out with anything in the future. Thank you so much. Thank you to Greg and Cosi. Thank you to everybody who was watching tonight and participating. We hope you will join us. We're going to try to do this twice a month now, and we're always looking for new topic suggestions. So if you have some problems, let us know, and we'll try to help you out. Thanks you
for
so
tuning
much.
in, everyone. Thank you, Jamie. Thank you, Cosi. Thanks for tuning in, everybody. Okay.
Have a good evening.
Good luck, everybody. Good night.